Hello, my name is Vaikuntan Rajaratnam, and this is part of my assignment for Instructional Design and Technology module, Managing Intellectual Capital. I work in Khoo Teck Puat Hospital, which is a hospital in Singapore. Khoo Teck Puat Hospital is one of the new hospitals opened in 2010, which caters for the community in northern Singapore. It is an acute care and a general hospital with 570 beds. It's a government-run hospital, and in Singapore, it is one of the restructured hospitals, meaning that it also accepts private patients for care. As a healthcare industry hospital, we are involved in a knowledge-based industry, as what we do is to utilize the intellectual capital, which is the knowledge that our staff, doctors, nurses, and allied health professionals have with the relationships with patients and other partners involved in the delivery of healthcare, together with the organizational structures and processes through which we deliver a high quality care for our patients. So the fundamental processes involved in the delivery of healthcare is the way in which we manage this knowledge, and therefore we are in a knowledge-based industry. Our fundamental process is we collect data every day, from patient encounter to the assessment of patient's condition through various vital signs, blood tests, and radiology, plus all the data that is entered through the various transactions that occurs during the delivery, assessment, and management of healthcare. This is then stored as information within our systems, and from which personnel will then obtain these data and information, and through their thinking process obtain knowledge from which decisions are made to ensure a high quality care is delivered. Truly a data-based industry. So what makes us unique in being a hospital, which is a knowledge industry, is that we have a significant portion of our value in the organization is based in our non-tangible assets. The building or the machineries are pure enablers for us to help deliver our care. So our basic, fundamental, unique selling point is our non-tangible assets, which consist of basically classified into three areas, which is human capital, which is our people; the structural capital, which is the organizational structure and processes and enablers that allow the people to work in a way that is effective and empowered to deliver quality care. And then we have our patients and partners, that is the vendors, the various other healthcare groups that we partner with through which to deliver this. And this relationship that we have with the external partners and also our patients, who are fundamental in our business, plus the people within our organization, is what produces our non-tangible assets, which can be classified as intellectual capital. Once again, our intellectual capital, therefore, is human capital, structural capital, and relational capital. So what a business does is basically takes resources, usually in the form of plant and machinery, with raw materials, to add value to it through its processes and to produce a value created item, which is then markets and obtains revenue to fund for the process of producing its product, services, and then the balance is kept as profit. In our organization, the most important component, as mentioned earlier, is our intellectual capital. So the intellectual capital is our resources that is used and utilized effectively to produce our services. Yet, in the financial statement of our organization, intellectual capital is not incorporated and is not reported anywhere. And the data of the intellectual capital is not even captured. And I quote our Chief Financial Officer, who says that we don't capture any intellectual property in our financial statement. The conditions to recognize intellectual properties are fairly stringent and we don't have anything that qualifies, i.e., the regulatory requirements of the reporting of a private limited company in Singapore do not allow for intellectual capital to be reported. So why is intellectual capital important? Intellectual capital is important and crucial in the day-to-day running of our hospital because it is what that allows for the effectiveness of our hospital. It provides the opportunity to produce innovation within our staff through their various interactions and processes. It adds value to the service that we provide. And crucial in healthcare is the intellectual capital that helps us reduce errors and litigation, therefore cost to society, to our organization. And it's the driver for growth. How do we expand and we innovate our processes of delivering healthcare comes from IC. It is the driver for quality in our care, in healthcare. And the importance and how we measure and value intellectual capital in our organization will be responsible for the attraction of talent and the retention of talent, which is a major problem in Singapore. And most importantly, intellectual capital is what will help us to maintain our sustainability throughout time. So we can see, therefore, that we need to manage our intellectual capital in Khoo Teck Puat Hospital. How we do that? We don't need to reinvent the wheel. The CICM Model, which is the Comprehensive Intellectual Capital Management Model, is a useful tool that we can use to help us to understand our intellectual capital, to capture and record these capital, and report on them after measuring its valuation. Even though it's not a regulatory requirement now to report our intellectual capital, maybe it is time now for the organization to have a separate addendum to the annual financial report, which is our intellectual capital report, based on current evidence in the literature on the best form of reporting intellectual capital that is reliable and accepted. Basically, there are three main areas. First is the knowledge management stage, which is the stage in which we start to get an inventory of all the capital that is available, the various sources of knowledge that is being stored both formally and informally. The next phase is the innovation management phase, in which we looked at ways in which innovation can occur within the company through the use of structures and processes and various cultural changes within this people who work at the ground levels in the organization, so as to be able to then provide enhancement, efficiency, safety, and quality within the healthcare. So the innovation management is the ability to capture these processes and produces and products and artifacts created by the people with their knowledge management and make them available for others to use for reproducing and for modification. Then the final phase is the intellectual property management phase, in which all artifacts, be tangible and intangible, created through the knowledge management within the organization is codified, is classified, archived, and stored for others to view and modify. And in those situations in which they have produced a tangible artifact, to see the viability for intellectual property registration, the use of inventions and patents, and in the case of clinicians in the production of original research articles in the various peer-reviewed journals, and these becomes the intellectual property of the organization through its staff's knowledge management.